So where are we in Georgia at this point in time? Well, in Georgia, we're seeing, first of all, a slight increase in cases. And I want to emphasize this because this has caused some confusion. Testing doesn't cause cases. Testing simply diagnoses cases. When you have an infection, a test tells you who has it. So doing testing and saying, well, we have more cases because we're doing more testing. No, we have more cases and we're finding them out because we're doing testing. But if we weren't doing the testing, we will still have more cases. Well, the reality is this is not going away. The reality is this virus is going to be with us, and it's going to be with us for quite a long time. So I don't think we need to get away from this idea that we're going back to normal. I'm sick and tired of this, and I need to get back to normal. I think we need to adapt to a new normal. And what that new normal will be is a new normal in which, yes, we're going to have to do what we do. I mean, I come to work on a daily basis. I'm a physician. I see patients. I really haven't changed what I do that much. But a couple of things have changed. Number one, I don't leave my office without a mask. I don't have a mask right now because I'm alone in my office. But if other people were here with me, I would be wearing one. But as soon as I leave my office to go out to the street, to go out to the hospital, to go out to the wards, I put on my mask. Number two, I think when we are seeing patients, or if I was in a very crowded environment, I would probably also would wear a face shield. I think we have learned a lot of the infections can come in through your eyes and your conjunctiva. So I think face shields have a value. I think hand washing and I think, social distancing are critical components. And I guess I really, really want to emphasize that while face masks have become a point of political discussion, in my mind, face masks are simply about protecting ourselves and protecting others. And we need to get away from politics and really need to talk about what do we need to do to protect ourselves, to protect our families, and to protect our friends from not getting infected.
What we've seen in Northeast Georgia is an outbreak that is very heavily centered in the Latino population. Again, largely connected to poultry plants, but because the communities in Northeast Georgia and the Latino population tend to be multi-generational, multi-family in single-family homes. We also see a lot of crowded conditions when they go home. So they're working in a crowded condition, and then they're going home and living in crowded conditions as well. And we know that COVID-19 is going to take off in situations like that. So we've seen a really increased number of cases in the Latino population. So when you look at a county like Hall County, where we've been working, we see an increased rate there per 100,000 than we do in a lot of other parts of the state. But if you were to break it out in the Latino population versus the rest of that county, we really see it almost as double. So all county rates are not equivalent across the county. And that's one of the things I want to make sure we talk about a little bit today. So essential workers, poultry plant workers fall into that category. And as Dr. Del Rio was suggesting and saying, they didn't have the privilege of staying home. There was no time off. So when the rest of us were telecommuting at home in March and April and May, and I'm still at my home when I'm not out in the field, they didn't have that opportunity or that privilege. And so their risk continued the entire time while the rest of us were socially distancing. A lot of poultry plants have put in place some very strong barriers to make sure that the contamination across employees would be limited. And so they are wearing face shields, they are wearing masks, they have barriers between the different production units. And so that's all really positive, but some of that might have been put in place a little later than we would have hoped, and so that the outbreak had already seeded inside the community. As we look across Georgia, we really see that there are lots of outbreaks driving our numbers, and these outbreaks are different depending on what part of the state you're looking in. Dr. Del Rio talked about the numbers are really highest in Metro Atlanta, but that's not per population numbers. So the rural communities we see are carrying an inordinate amount of risk for COVID-19. Those communities are affected very differently based on social determinants of health, like population density, poverty level, crowded living conditions, underlying chronic health conditions, and availability of medical services, including testing in areas. We also see the demographics are really different based on certain areas of the state. So as I said before, northeastern Georgia is a very Latino-driven outbreak connected to the poultry plants and multi-generational living situations. When we go to middle Georgia, we're seeing a lot of African-American population outbreaks. Again, having a lot of crowded living conditions, a living below poverty line, underlying comorbid conditions that are higher than we would like to see in our population, with very, very high rates of obesity and hypertension and diabetes. And we know a lot of these comorbidities are due to structural and systematic inequalities that are often very generational. And then when we look at the southern border of Georgia, where we see some strikingly high rates, we again are looking at a Latino-driven population in a lot of those counties where we've got agricultural workers who are migrant pickers who are living in very, very crowded barracks, and they are riding to the fields where they're picking in crowded buses, and they really have no ability to socially isolate. So as we look across the state, we need to be cognizant that we've got different outbreaks going on across the state, and different underlying conditions are driving each of those outbreaks.